Next section we'll continue here. Hemostasis refers to stopping bleeding. So when you get a cut, you don't want your blood to continue to flow. You want it to stop. So following injury to a blood vessel, there's three things that happen. One, there's a blood vessel spasm, is what it's called. Formation of a platelet plug, and then your blood will actually clot or coagulate. When you cut into a blood vessel, it causes the muscle in that blood vessel to contract. And that contract is basically called vasospasm. Vaso means vessel. So vasoconstriction, vessels get smaller. Vasodilation, they get bigger. Vasospasm, basically that blood vessel is contracting, it's having a spasm. That's going to last a very short period of time. The reflex will. 30 minutes basically is what the entire time frame is. So once my vessel has spasmed, platelets then are going to release serotonin, and that serotonin is going to cause constriction of the blood vessels. Constriction is going to slow down bleeding. So serotonin is responsible for that constriction. Once my blood vessel has constricted, platelets then are going to start to stick to each other. They're going to stick to the edges of that blood vessel, and basically they're going to form a block. They're going to form a net that crosses, and then it basically tries to stop or form a bridge to prevent things from going through. A platelet plug then is this plug that's formed by these platelets piling up and attaching to the blood vessel and to each other. And that's very effective for small blood vessels. If I cut my aorta, my aortic arch, which is a very large vessel, that platelet plug is probably not going to form fast enough or large enough. So I get a cut. I cut my finger on a knife or something. Blood begins to escape from that vessel. It's coming through your skin. So here I can see how those platelets start to stick to the edges first, where it's broken. They pile on top of each other, and then the platelet plug is what actually stops the flowing of the blood in a small vessel. Blood coagulation, or clotting, is the most effective way for also larger vessels. So very complex blood clotting factors. So people who have hemophilia lack, they don't have some of these blood clotting factors, as well as calcium. So here, again, your tissue is damaged, and they're going to release a chemical called thromboplastin, thromboplastin, and that's going to basically start the series of reactions that's going to induce coagulation. So when thromboplastin is released, it activates the first in a series, and that leads to production of prothrombin activator. So there's kind of a series of steps. This prothrombin activator converts prothrombin in the plasma into thrombin. So pro means before. So prothrombin is before thrombin. And then this in turn is going to start a reaction that converts fibrinogen into fibrin, and fibrin is the part that's going to help to clot the blood. So that might be a slide you want to go back and look at, because there's new words there that you'll want to look through. Here you can kind of see clotting of the blood and how that fibrinogen basically kind of forms a net and clots around the blood. Major event is basically that fibrinogen forming fibrin, and that's the picture that we just looked at. So fibrin actually causes the blood cells to stop or catch or slow down, as opposed to platelets just blocking things off. Serum Blood serum is blood plasma without any of the clotting factors that are inside of it. The amount of prothrombin that's formed is proportional to how much tissue damage you have. So the worse the damage, the more thrombin that will eventually be produced. Once a blood clot forms, it promotes more clotting, and this would be an example of positive feedback, which we've said there's very few of that. Once your blood starts clotting, it's going to clot more instead of less. So that would be an example of positive feedback. After the clot has formed, eventually it stops bleeding and you don't want your blood to clot anymore. So then plasminogen is converted into plasmin, and plasmin is the chemical that gets rid of that fibrin so your blood does not stay clotted. Fibroblasts, fiber building, then enter the area. They start fixing the repair. They're going to repair the vessel. They're going to form connective tissue and basically seal up that blood vessel where it was broken at. A clot that forms abnormally, this is not, if you've heard of people having blood clots like in their lungs or legs or something like that. A clot that forms abnormally is called a thrombus. If that thrombus dislodges, it moves and is going through your veins, then it's called an embolus. And when you have any type of surgery, childbirth, something traumatic to your body, it increases your risk for blood clotting. So they'll encourage movement of the body and limbs so that you do not form blood clots. And last slide that we'll look at today, this is just kind of the step-by-step formation. So here, tissue damage, if it's small, you'll stop right there. If it's a small damage, blood vessel spasm, platelet plug, that stops the bleeding, we're good enough. If it's larger damage, then we're going to go down into the clotting mechanism and go through the steps that actually cause your blood to clot. So that's where we'll stop for today. Next lesson, blood groups and transfusion.